everyone. Thanks for checking out my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I look forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions each week to discuss in the vlog. I know I sound like a broken record, but it's a good thing. Cases and hospitalizations keep falling. Boston wastewater viral levels are at pre-Omicron levels. In a pretty stunning series of announcements, governors of some of the more COVID restrictive states have announced plans to restore normalcy in the form of dropping mask mandates and other restrictions, in some cases even school mask mandates. These include New Jersey, Connecticut, Oregon, Delaware, and California. While Massachusetts doesn't have a mask mandate, some of its cities and towns do, and there's talk of end dates for some of those too. And this week, the Massachusetts Commissioner of Education has confirmed that the school mask mandate will expire as scheduled on February 28th. This is making a lot of people very nervous and a lot of other people very happy. It's worth noting that the absence of a state school mask mandate doesn't mean that individual districts can't mandate masks. So now we can expect to see some contentious school committee meetings. Never a dull moment. Our first question comes from Darlene from Rockland. I was diagnosed with COVID-19 before receiving my booster. How long after recovering should I wait before getting the booster shot? Also, if someone is diagnosed with COVID-19 and is unvaccinated, how long should they wait after recovering before starting the vaccination process? Well, questions about when to get vaccinated or boosted after infection are actually the most common ones that I receive. There's no exact right answer. The CDC says you can get vaccinated or boosted as soon as you are out of isolation from your infection. And it's definitely safe to do that. But is there an ideal time? I don't know. Some studies show that getting infected is about equivalent to 1 dose of vaccine. So if you're double vaccinated and then get infected, you could probably wait a couple of months to get the booster if you want. Maybe see whether an Omicron specific booster gets rolled out, though I am skeptical that it will. And certainly if a new variant comes onto the scene, you'd want to hurry up and get a booster to increase your protection. Now, if you're unvaccinated, then I think you should go ahead and get vaccinated sooner because you may not well be protected against the next variant or even the BA2 subvariant of Omicron, which we're still learning more about. Our second question comes from Frederick from Norwood. Every other week, I Zoom with 12 to 14 old college classmates, all of them well-informed and sharp. A recurring question in this 65 and over age group, who are all COVID boosted and flu vaxxed. If they now pursue activities like going to the gym or a restaurant, how does their risk of COVID hospitalization and COVID death currently compare to their risks of flu hospitalization and flu death? Frederick, that Zoom sounds like a lot of fun, and I wish I had an every other week Zoom with my college friends. Here's what I found for you. These data taken from CDC show a hospitalization rate of 316.4 and a death rate of 22.1 per 100,000 in the 65 and over age group during the 2019-2020 flu season, which is the last normal-ish flu season that we had. Remember, that flu season ended early and abruptly due to the pandemic. So those numbers might have been even higher had COVID not come along. Now, flu data and COVID data are really handled and modeled very differently. So it's not really an apples to apples comparison, but let's compare it roughly to what the CDC is reporting for COVID hospitalization and deaths. For the vaccinated and boosted, the rate of COVID hospitalization for those over 65 during the time period from September to December 2021 was 4.9 per 100,000, compared to 245.6 for the unvaccinated. The rate of death was 0.49 per 100,000. Let's make some big assumptions to be able to actually compare those numbers, because the time periods are not the same. So let's assume that a flu season is 6 months. In actuality, it was shorter that year, but we're making rough comparisons. The COVID data is from about a 3-month period, a little less. So if you double it, you get the following comparison. Flu hospitalization, 316.4 versus COVID hospitalization, 9.8. Flu death, 22.1 versus COVID death, 0.98. Pretty good. Importantly, people over 65 also qualify for COVID therapies, including the oral agent Paxlovid, which has almost 90% efficacy at preventing hospitalization. So I say go to the gym and restaurants. You're only young once. Our last question comes from Allison from Grafton. The COVID pills were called a game changer when they were FDA approved, but I haven't heard anything about them in weeks. Are they available and effective? Who's eligible, and when can they receive them? Allison, I'm so glad you asked. We have the COVID pills Paxlovid and Molnupiravir, as do other hospital pharmacies, but we aren't getting a lot of prescriptions for them, and we would like to. Paxlovid is nearly 90% effective at preventing progression to hospitalization. Its drawback is that it has a fair number of drug interactions, so depending on your other medications, you might not be a candidate. Molnupiravir is about 30% effective at preventing hospitalization, but there aren't drug interactions. It's not recommended for men or women trying to have a baby. Yesterday, the DPH, Department of Public Health, announced that Walgreens pharmacies are going to stock those pills as well. Now, those pills work best if you start treatment within 5 days of symptoms. So if you feel sick, get tested right away and call your doctor. And if the pills aren't right for you, we have injectable therapies too that we can give you in the hospital as an outpatient. That's all the time we have for this week. You can send me your questions about mask mandates, COVID variants, our new normal, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again next week.